30th, Thursday, of course, at 9:30. And thank you so much for joining in today. Pretty full agenda. There's a lot that's going to be happening as we move closer to 11:15. But just some quick housekeeping items. If you do want to ask a question, you can do that either by clicking on the little hand icon on the control panel to the right of your screen, or you can just type in a question, which we'll answer at the end of the presentation in our open forum. And again, we can all learn together. So let's get right into it. We've been talking week to week about our web broker status and, of course, any enrollment portals that we're offering. EBIX is going to really be the key for us, I feel, and it's going to be for both on and off exchange. They are working to allow the on exchange when redirecting to healthcare.gov to not require a consumer account creation or the 4 identity proofing questions. So again, there's a lot that I think can be used even with a healthcare.gov paper app and doing a simple data entry function as opposed to a live enrollment. I see opportunity there. We will have ACA Express on our website. This is going to be on only. Again, it's without account creation or identity proofing. There is going to be a bit of reporting on the back end for you if you use this system. Carriers are coming out with their own direct enrollment portals. Some are on, well, all are on and off. Some will have the ability to bypass the account creation and identity proofing. Others will not. And I wanted to, for anyone that was at the Highmark meeting on Monday, they did a little bit of a demo at one of the tables on their portal, and it's looking pretty slick. So I wanted to just do a special note, since a lot of business has been submitted for 2014 with Highmark, and also all of their plans, their medically underwritten plans, are going to be terminating 12/31. So you need to really address the twofold your client base. And their portal is going to allow for you to log in under your agent portal and pull up all your accounts by either their account number or ID number or their social security number. If it's off exchange, you're going to be able to re-enroll them onto an ACA product in a matter of minutes. If it's on exchange, it's going to pull it up, and again, you can redirect to healthcare.gov, and if the client wants to change their plan, they can do that very easily. So I did think that at this point, their system and what they're going to be launching seems to be, something that's going to be utilized pretty heavily. So I would just say, if you don't have your username and password for highmarkblueshield.com, I would go in, try to log in, and follow the prompts for forgot username, forgot password, all of that, so that you can be prepared to hit the ground running on 11/15, so that you can, help your clients without getting bogged down and trying to log on to a site. So among our web broker and enrollment tools, and these are not all of them that I listed, we're going to have a lot of solutions for you, but we also have a program called Code 64, and it's really an analytical system that takes information from your small group, puts it into this program, and determines what the best course of action may be for your small groups or even your large groups. It does, on the front end, require a lot more information to be gathered, such as your spouse's income as well as the employee's income, so that you can get a really true barometer of how many employees would qualify for subsidy even at what level, if it's the 100 to 200, etc. So we do have some tools. We have some great tools, and if you are looking for a specific tool, all you have to do is ask. But my message to you is that we have a lot of things that we don't advertise day in and day out, but we really are very well prepared to help you through individual enrollment, both on and off, and also small group and large group enrollment, whether it's shock for the small group or off exchange, off shock, or just a large group. So all you have to do is ask, and if we don't have it, we'll look into getting it if it's something that you feel is important. So at the Highmark meeting, on to our next bullet point, they did discuss some of their individual products as well as their group products, but specifically for the individual plans, they are not retiring any of their plans in Central PA. They are adding 2 new families of plans, and they're based on an ACO, Accountable Care Organization, or the Patient-Centered Medical Home. There's going to be a family plan, if approved by PID, called Balance Blue. It's going to be a $500 deductible 90/10 plan in the gold category. They're also going to, under the Balance Blue, have a $2,000 deductible 80/20 plan under the silver category. On their total health program, there is, and this is a patient-centered medical home program, it's a $1,200 deductible 80/20 plan, and there's a reduced copay by using a patient-centered medical home facility and an increased copay if you don't. But these 3 plans are really, at their base, going to have, just some coordinated care, some oversight by an accountable care organization, and they also have some wellness rewards built in where each member, if they do an online wellness assessment, will receive a $50 gift card. So I think, again, it's important to know that the network is truly important. It's important for us. It's important for our consumers. But, these networks are getting more narrow, and, that's just the wave of the future. So it's not necessarily a bad thing. It is one of the ways that this law proposes, at least in theory, to bend the cost curve. So, I consider this, among many negatives, I consider this one of the positives. We also had a Capital Blue Cross seminar, and many of you attended that as well. They are revamping their entire plan portfolio on the individual side, and just to note, they also will have an ACO type plan with Care Connect. It's going to be for off exchange only, but it is based around the Pinnacle Health System. Again, driving consumers to where the carriers get the biggest discounts and where those discounts are passed on to your clients in the form of premium savings and also, just better overall health care. I say with this Care Connect program, it might not be a bad idea to look at your Geisinger health programs on the individual side that need to utilize the Pinnacle Health Systems, and it, in my opinion, would be a perfect match for this Care Connect PPO. Because if they're losing Pinnacle with Geisinger, and that's very important to them, then they would more than likely be open to having a Pinnacle Health System health plan network. So, of course, more information is coming on that. Geisinger did also release their mapping for their current plans to the 2015 plans, as well as released their 2015 plans. No rates have been released, but we are working to put that information on our website under product information under individual health and Geisinger, and under the 2015 plan design. So you're going to see that information. Again, no rates are out there. There is some rumors floating around that on November 8th, which is, of course, a week prior to the opening of the opening enrollment season, that there will be rates on healthcare.gov and plan designs. Of course, you can't make application, but if what they're saying is true, at least we can get at least a week's look before we really have to start doing business. On to the next bullet point, Sam Bohr, as many of you know, he is our Director of Ancillary and Supplemental Lines. He's having a webinar today at 11. Going to talk about the new tools that we have for the ancillary side. I think it's really slick, the things that he has done and helped to create. And certainly as premiums increase and deductibles increase to, kind of mitigate the damage of the increased premiums, there's an underlying health plan need for these GAP programs and ancillary programs, both on the individual and group side. So if you have not signed up for his webinar, I would encourage you to do that. It's going to be short and informative, and you can register for that by going onto our homepage at urlinfgroup.com and signing up for it at 11. So the next bullet point, Highmark 11-1 group renewals. They can be submitted up to tomorrow because of the Geisinger system pulling out of Pinnacle. So they've extended the renewals, so just be mindful of that. And of course, if you have, like many of us do, have 12-1 group renewals, they must be submitted by 11/15 if you want to keep the grandmothered status, which is pretty important to most of us. There was a piece that was just put out by CMS. I don't know if any of you have seen it, but it is going to be in my newsletter today, and it's 5 steps to staying covered through the marketplace. I think it's not a bad idea to go and print this and maybe give you an idea to brand it to yourself and get it out to your current customers. This may cut down on some of your workload in getting these people re-enrolled or changing plans if they choose to. But it is, I think, a pretty good piece. And again, that would be in my newsletter. So go ahead and you can pull that up once my newsletter is released. And again, extended hours. 11:15 happens to be a Saturday. Most of us stay in our sweatpants on Saturday, including myself, but it looks like on November 15th that's not going to be an option because we have to be open for business. I'm sure we will have a lot of questions coming in, and keep thinking that your consumers will also more than likely be off work on the weekend and have the time and the luxury to go into healthcare.gov. So we felt it was important to make sure that we are open at least for a good part of the day to help you answer questions. I am predicting that healthcare.gov is going to be overloaded and it may not be working. I could be wrong, but that's just my thought. So again, all of these systems that we talked about at the beginning, they are, when they're redirected to healthcare.gov, they're at the mercy of healthcare.gov, and if it's down, the systems are going to be down, no matter what system we're using. So again, we're open from 10 to 2, and we're working other key dates as well during the open enrollment because we appreciate your business and know that it's important for you to get in touch with us when you need to. So be mindful of those hours, and we're happy to help. So that looks like, well, doesn't even look like, it is all that is on my agenda, and I'm going to pull up the questions now. And go ahead, if you have any, to go ahead and type those in. Jay says to all of us, good morning and happy Hallows Eve. Spooky PPACA news is in our forecast. Yes, I believe that's true. James says, did Highmark make any changes to their individual commission schedule for 2015? They did not. It would be nice if they increased the numbers. Absolutely, I agree. At our seminar yesterday, and not to steal Cap Blue Cross's thunder for anyone that didn't attend or will be attending their actual rollouts, but they did change their commission structure from a flat 6% of premium level to $21 per member per month, and that is capped at 5 members per application, and that is your portion. So I think that is a pretty substantial commission, and we really hope that that they're, you know, very competitive. That's their goal, to be competitive. And, you know, again, that's going to be an increase for all of us. So we're excited about that. So I will give it a few more minutes. It doesn't look like there are any other questions coming in. Did want to mention, as always, that we do have webinars every Thursday. Next webinar is Thursday, November 6th. Can you believe it's November already at 9:30? And, you know, we're here to help. As soon as I get information, I'm going to be sharing it with you. While we were talking, some more questions came in. Renee asked, is anyone having issues with setting up accounts on healthcare.gov and getting the verification email instantly? And yes, and I'm not sure what that problem is, Renee, but yes, we've experienced that as well. I don't know if it gets caught in the spam or if it's just, you know, one of their many enhancements that works against us, but I've heard that. So that is about it, all the questions. As always, I appreciate your partnership and the business that you do choose to submit through URL. We're happy to help. You know, I oversee the individual and the small group and traditional group division. So please, we're not a one-trick pony. We do quite a bit of group health. If you have a need for group health and want to find a home, you know, we're happy to have you. Just give me a call, and we're happy to help you out. Everyone have a great Halloween and a great weekend, and we'll meet up here again next week. Thanks again. Bye-bye.